This is okay. Hi, this is the doctor diagnostic system. As you can see, when the doctor presses the push button, and the patient's ID will be shown here. This is sent through from the registration system through IO port. Okay, so click enter. Okay, this is the patient's form. Okay, over here on the right, you can clearly see the temperature and the pulse rate that is measured earlier in the registration system. Okay, this is obtained through a shared folder system. Okay, then over here you will will be able to view the medical history of the patient. Okay, so the doctor can check the patient's medical history. And over here you key in the diagnosis and the prescription, and over here the doctor will state the patient status as outpatient or to be warded. Okay, upon confirm, the form will close and the information will be stored into the shared folder system for the other subsystem to obtain the information from. Okay, now we'll move on to the smart ward system. Okay, in the smart ward system is divided into the day and night functions. We'll first look at the day functions. Okay, there's a smart lighting system where the room will check for the ambient light. Okay, if there's sufficient ambient light, the room light will be switched off. And when there's insufficient light, the room light will be switched on. Okay, upon entering the toilet, okay, the toilet will be switched on and switched off when it leaves. Okay, then there will be a microphone. Okay, this will be used to detect the noise level in the room. Okay, over here at the panel, you can see the meter showing the noise level of the room. Okay, if the room is too noisy, the warning light will be switched on, warning the nurse to check on the ward. Okay, now we'll move on to the night functions. Okay, in night function, the main focus will be the patient tracking. Okay, as you can see, this I'm using a push button to simulate the patient resting on the bed. Okay, once the patient leaves the bed, okay, floor lights will be turned on. Okay, and then there will be a signal at the control panel stating that the patient is not on this bed. Okay, when the patient enters the toilet, okay, floor light will be switched off, toilet light will be switched on. Okay, if the patient is in the toilet for extended period of time, signal or warning will be given to tell the nurse to check on the patient. Okay, upon checking, she will manually reset the system, and if the patient exits the ward, okay, there will be immediate warning telling the nurse. Okay, same thing, it will be manually resetted. Okay, so upon changing back into the day system when the night has ended, okay, information of all the warnings in the night will be sent using the IO ports and RS-232 to the doctor diagnostic system, stating what status is retrieved, and it will be recorded as shown.